day everyone, I am Luigi Strada from MSU Basin 1 and today I am going to perform offering and removing a bedpan and urinal. So bed patients often need to use of a bedpan once or twice each day. As a routine, the ward may be closed with a screen for this reason. However, if a patient requests a bedpan at a later time, you should respond with understanding and without delay. So the purpose of this is to offer a person who is unable to ambulate with a wheelchair a chance to urinate or defecate. So first, bring the bedpan and other necessary equipment to the bedside. So arranging things conserves time, energy, and avoid unnecessary stretching and twisting of the muscles of the nurse. Then the equipment to be used are the bedpan or the urinal. So we have it here. Then we have also the disposable bedpan cover or the paper towel. So we have it here. Then we have also the toilet tissue. We have it here. Then we have also the washcloth. Also this one is the washcloth. Then we have also the soap. So we have it here, the soap, and also the receptacle. And we have the receptacle here. Then also the cotton balls and the alcohol, we have it here. And also the towel, so we have the towel here. And also the pen and the documentation record, so we must not forget it because it is important to the nurse. Then considerations before, during, and after the procedure. So before the procedure, you must guarantee that all the necessary equipment is available. Then ensure that water or an alcohol-based rub is accessible. Then for during the procedure, always remember proper body mechanics to prevent overstretching or body straining. And make sure to do so. Then follow the necessary standard correct procedure in doing so. Then collect specimen as required. Do not rush the patient. Be sensitive to the patient's conditions. Then, allow the patient as much privacy as possible. Then after the procedure, you must document the result. So things to document after the procedure. Assessment procedure done or performed and the results of the assessment. Then, do hand washing or apply alcohol and then done on gloves. So this is to prevent the spread of microorganisms. Then, pull curtain around client's bed or close room door. Then place a bed blanket over the client's abdomen and thighs. So this provides client's privacy during the procedure. Okay, so now I am going to introduce myself to my patient and verify his identity and of course explain to him the procedure that I am about to do. Okay, good morning sir. I am Luigi Strada, your student nurse for today. May I see your wristband please? Okay. Please state your complete name and your birthday please. Okay. So today I am going to offer and remove the bedpan and urinal. Is it okay with you? Okay. So now, I am going to expose the lower half of the patient's body so as not to fully expose some parts of the patient's body. Okay, so now, I am going to ask the patient to bend his knees and lift his hips upward. Okay, sir, please bend your knees. Okay, and lift your hips upward. Okay. Then I am going to assist the patient with placing my hand under the patient's lower back and assist with that lifting. And I am going to place the waterproof pad and then slip the bedpan into the place with the other hand. Okay, sir, please lift your hips. Okay. So now I am going to place the waterproof pad. Okay, sir, please lift your hips again. Okay. Okay. So this is the lesson, the energy needed when lifting the patient. Okay. Okay, so now I am going to cover the patient with a back blanket. So this is to facilitate the illumination and provide privacy. Then I am going to ensure the proper positioning of the bedpan. So the patient's buttocks must be resting on the ground shelf of the regular bedpan. Okay, sir. And assume that the head of the bed is in a 90 degrees position. Okay? So giving the tissue to the patient will help him clean himself up. Then I am going to raise the side rails and leave the patient if necessary. Okay, sir, I'm going to raise side rails. Okay, so that is all for offering the bedpan. So now we are going to tackle the removing of the bedpan. So removing of the bedpan. So first, we must perform hand hygiene and don on clean gloves. So assuming that I have already washed my hands or applied hand hygiene, then I am going to don on clean gloves. So I have already finished donning on clean gloves. So now I am going to get warm washcloths. Okay, sir. Okay, please relax, sir. So here's the warm washcloths. So this is to facilitate the cleaning of perineum. So I am going now to lower the head of the bed and ask the patient to bend his knees. Okay. So assuming that I have already lowered the head of the bed. So sir, please bend your knees. Okay. Please relax, sir. Okay. Bend your knees. So this is to facilitate the cleaning of the perineum. Okay, sir, I am going now to remove the bedpan in the same manner it was offered earlier. Please lift your buttocks up from the bedpan. Okay. I am going to assist the patient by placing my nearest hand to the patient's lower back. Okay. Thank you, sir. Then I am going to put this on the spectacle. So this is to lessen the energy needed by the nurse in lifting. Okay, sir, please relax. So using the trash bag, I am going to remove the bedpan using the trash bag. So this is to prevent the spread of microorganisms. So I have already put the bedpan on a spectacle or the trash bag. So now I am going to clean the perineum. Okay, sir. Please bend again your knees. Okay. You don't have to lift your hips, sir. Okay. So this is for the comfort of the patient and also to avoid the infection. Okay. Please relax, sir. Okay. It's clean now. So now I am going to remove, sir, the waterproof pad and throw in the proper receptacle. Okay. This is to prevent the spread of microorganisms. Okay, sir. Please lift your hips. Okay. Then I'm going to cover the patient. So this is to help keep the patient comfortable. Okay, sir. Please relax, sir. So now I'm going to clean and empty the bedpan and clean and sanitize the bedpan. Okay, sir, please relax, sir. I am going to clean the bedpan, sir. Okay, is it okay with you? So cleaning reusable equipment helps to prevent the spread of microorganisms. Okay, sir, I'm going to clean that bed part. I'll be back. Okay, sir, I'm feeling okay, sir. You're feeling better. Okay. So using the other wash clothes, I am going to clean the patient's hand and cleaning each finger individually. So this is to prevent the spread of microorganisms. Okay, sir. Okay. I'm going to throw this on a spectacle and get another wash cloth. Okay, so please open your hands. Okay. So now I am going to adjust the head of the bed in a comfortable position. Please, sir, please. Are you comfortable with this position? Okay. So this is to promote patient comfort and safety. Okay. Then I'm going to remove the bed blanket from the patient. So this is to provide comfort. Okay, sir, please lift. And okay. I'm going to put this on a receptacle and arrange the patient. Then remove gloves and perform hand hygiene. So this is to prevent the spread of microorganisms. I am going to throw this on a spectacle. Are you feeling okay, sir? Then, document procedure and report any abnormal findings. This is for legal purposes and for future references. And we have to remember that what is not written is not done. Thank you for listening. Okay, sir, thank you for your time.